have second and third degree burns over 15 to 20% of your upper body, I'm going to recommend that you be transferred over to the burn center at Treeline Hospital.
Mrs. Quinn, I see that you're with Jupiter HMO. Our hospital does not contract with Jupiter.
You mean I have to pay the bill myself?
Well, I do know that Acorn Hospital does contract with Jupiter. So if you'd rather go there, we can certainly do that.
But I really want Dr. Simonson to deliver my baby. He's my doctor.
Yes, I know, but Dr. Simonson can't see you here.
Then I want to go to Acorn Hospital where Dr. Simonson can deliver my baby.
There are regulations that govern when and how an unstable patient may be refused treatment or transferred from one hospital to another. These laws are complex, and your failure to comply with them could result in fines of up to $50,000 per violation. These fines are not covered by your insurer and are determined in a court of law by non-medical individuals. In extreme cases, eligibility for Medicare reimbursement and your hospital's accreditation can be denied. This video will help you better understand these regulations, known as the Emtala laws. Emtala stands for the Emergency Medical Treatment and Labor Act and is also known as the Patient Dumping Act. The Emtala regulations are part of the COBRA laws, and they establish rules for the transfer of unstable patients from one facility to another. The law applies to all hospitals that offer emergency services and covers all patients treated at those hospitals, not just those who receive Medicare benefits. It seeks to guarantee that patient care is not compromised by the convenience of the practitioner or by the patient's ability to pay. The Centers for Medicare and Medicaid Services issued a final rule in 2003 clarifying hospitals' obligations to patients who request treatment for emergency medical conditions. But many find the rules hard to understand and easy to misinterpret. To help you better understand these changes, let's take a moment and break down some of the important clarifications found in the final rule. First, it clarifies that outpatient clinics that do not routinely provide emergency service are not obligated by Emtala. It clarifies that hospitals aren't required to provide 24/7 coverage in every specialty. Specifically, they can develop their on-call list to best meet the needs of their communities. It permits physicians to be on call simultaneously at more than one hospital and to schedule elective surgery and other medical procedures during on-call times. It also permits hospital-owned ambulances to comply with citywide and local community protocols for responding to medical emergencies instead of only bringing patients to the hospital that owns the ambulance. The rule also clarifies that a hospital's obligation under Emtala ends after the patient has been seen, screened, or admitted as an inpatient. And finally, it requires hospitals to wait until the patient has been screened and stabilized before requesting insurance authorization from the patient's insurer. Now that we've learned about the final rule, let's take a look at some typical situations and test our knowledge of Emtala compliance.
May I help you?
I have a terrible headache. It's really killing me. I need to see a doctor.
Okay, fine. Just sign here on the log sheet with your name and current time and have a seat over there. Miss Quinn, you can come over here now. All right, let's just get a little information from you and then we'll have the nurse take a look at you.
Okay.
Full name?
Beverly Quinn.
Date of birth?
9/10/69.
Have you been to this hospital before?
No.
Insurance company?
Jupiter HMO.
Do you have your card with you? Okay, please have a seat out there again and someone will take care of you very shortly.
Okay.
Mrs. Quinn, will you come in, please? Okay, Mrs. Quinn, I understand that you've been having a bad headache.
Yes, it's awful, and it's getting worse the longer I wait here.
How long have you been getting these headaches?
About a month.
A month? Okay. Okay, do you get them often?
A couple times a week.
Mrs. Quinn, I see that you're with Jupiter HMO. I'm not sure if you realize this, but our hospital does not contract with Jupiter. We're happy to treat you here, but I just wanted to let you know that because your HMO might not pay for it.
You mean I have to pay the bill myself?
Well, not necessarily. You'd have to work that out with your HMO. But I do know that Acorn Hospital does contract with Jupiter. So if you'd rather go there, we can certainly do that, although we're happy to treat you here.
What do you think? Did the staff handle this patient in compliance with the law? Or is there a potential Emtala violation here? Yes, this is a potential violation, and here's why. The Emtala law clearly states that patient screening cannot be unduly delayed to get patient information, such as insurance coverage. Now, if a nurse or other practitioner is unavailable or busy with other patients, then information can be taken from the patient while they wait, if that is the routine of the hospital. But that wasn't the case here. Since there was a nurse available to see the patient immediately, that patient could have been seen first. Also, this patient may feel discouraged from staying for a screening exam because of payment issues. It is safest not to discuss whether the patient's insurance will pay for the care provided until after the patient has been screened and stabilized. Signs about insurance coverage in the lobby or waiting area can also be a violation of the Emtala law. If the patient asks direct questions about coverage prior to the medical screening exam, emergency staff should indicate to the patient that the emergency department sees everyone regardless of insurance or ability to pay. And encourage the individual to defer further discussion of financial responsibility issues until after any necessary screening has been performed. It should be clear to the patient that the hospital is ready and willing to provide any necessary screening and stabilization services. Here's the bottom line. Every patient should be screened with the same expediency and thoroughness regardless of their insurance coverage or ability to pay. Let's look at another scenario.
Your injury is quite serious. You have several broken bones and injury to a tendon that lies right over one of the broken bones. There's also quite a bit of dirt and contamination in the wound. I want a hand surgeon to take care of this, to prevent infection and also to make sure that that tendon is repaired properly. We want to make sure that you regain full functionality of your hand. We do have a specialist available. I'll call him and ask him to come in and take a look at your hand. Do you need anything else for pain?
No, I think I'm okay.
Okay. So, given the risk of infection and the complexity of the injury, you'll need to come in and see this person.
Geez, Sharon, I'm at my daughter's Little League game. She's pitching today and the game just started. This is a really big deal for her. Look, let's do this. Your case is messy, but the skills required are pretty basic. I think this would actually make a great teaching case for the hand fellows at the Trauma Center at Memorial. Let's go ahead and transfer her over there.
Look, I'd really prefer if you would see this patient.
Sharon, I wouldn't be there for at least 2.5 hours. She's going to be seen a lot sooner at Memorial. Send her over there.
Sound like an Emtala violation? Yes, it should be obvious that this on-call surgeon's conduct is in violation of the Emtala law. The law states that an on-call physician must come in to evaluate or stabilize a patient when called, period. In this case, the primary reason for this patient's transfer was the convenience of the practitioner not to provide best care. From the on-call surgeon's own comments, we know that this case was fairly routine and did not require treatment at a hospital with a higher level of services. That would be the only legal reason for a transfer of this patient. CMS gives hospitals discretion to develop on-call lists to best meet the needs of their communities. Physicians are permitted to be on call simultaneously at more than one hospital and to schedule elective surgery or other medical procedures during on-call times. Hospitals must have policies and procedures to follow when an on-call physician is simultaneously on call at another hospital and is not available to respond. Hospital policies may include procedures for backup on-call physicians or the implementation of an appropriate Emtala transfer. Let's take a look at another situation.
Mr. Fairclough, You have second and third degree burns over 15 to 20% of your upper body. There's no apparent smoke inhalation injury, but we want to make sure that you get the best possible care for those burns. So I'm going to recommend that you be transferred to the burn center at Trimline Hospital.
Okay.
I think that would be best for you. Taking care of burns is a very specialized area, and they do it better than anyone. Is that okay with you?
I guess.
Oh, Jose,
Yes?
you know, I still haven't spoken to the emergency doc over at Treeline about the burn patient. Is someone still trying to get him?
The patient just left. I didn't realize you hadn't talked to anyone.
Didn't you call?
No, the ambulance was right here and available, so I didn't want to lose it and have the patient have to wait for another one. But anyway, they had to accept our patients. We have an agreement. But I will call them right now. Okay?
Okay.
All right.
In this case, the transfer seems appropriate. There is a clear need for a higher level of care that can only be provided at the receiving institution. So, is there any risk here for an Emtala violation? Yes, there is. While the transfer was warranted and legal, the law requires that certain administrative responsibilities be carried out when transferring a patient. First, written consent for the transfer must be obtained. If the patient is physically unable to sign a consent form, then verbal consent is acceptable. But this patient was basically told he was being transferred. He was given no opportunity to question or consent to the transfer. Here's the protocol you should follow when transferring a patient. In addition to patient consent, the reason for the transfer must be documented. The transferring physician must contact the physician at the receiving institution. Likewise, the attending nurse at the transferring hospital should call and make report to the receiving nurse. All pertinent patient records should make the trip with the patient to the receiving institution. Finally, the patient should be moved in the manner most appropriate to his condition, whether by paramedics, private car, etc. So, while we've just seen a perfectly legal reason for transfer, the transfer itself is a strong candidate for Emtala violation because these administrative responsibilities were ignored. Let's look in on another common situation.
I think I'm in labor.
When's your due date?
Next week.
Who's your doctor?
Dr. Simonson.
I'm not familiar with Dr. Simonson. Is he a doctor here in this hospital?
I don't know. I'm supposed to have my baby at Acorn Hospital, but it's too far. I'm in too much pain.
Okay. Let's get you up to labor and delivery and have someone take a look at you.
Well, you're definitely in labor, but I think it'll be a little while before you deliver. But you and the baby look just fine.
Oh, that's good to hear. Thank you.
I'm going to call the on-call physician and let him know where we stand and see what he wants to do, okay?
Okay.
She's dilated 3 centimeters, 50% effaced. Fetal heart tones are 140. Her contractions are 5 minutes apart.
Well, does she want to stay with us, or does she want to go to her doctor's hospital?
I'll ask her. Mrs. Hall, as you know, your doctor doesn't come here, but you are more than welcome to stay. Dr. Block, our on-call physician, would be more than happy to deliver your baby.
But I really want Dr. Simonson to deliver my baby. He's my doctor.
Yes, I know, but Dr. Simonson can't see you here.
Then I want to go to Acorn Hospital where Dr. Simonson can deliver my baby.
Well, we certainly won't force you to stay here. If it's your choice to go, then we'll make the arrangements for you and get you to Acorn. But I want to be sure you understand that we would be more than happy to deliver your baby for you right here.
Yes, I understand that.
Are you absolutely sure that you want to be moved?
Yes, I really want to go. I want Dr. Simonson to take care of me.
Okay. We'll make the arrangements. We'll call Dr. Simonson and let him know that you're coming. You'll have a few papers to sign, and we'll call the ambulance and have him take you right over. Your records are already there.
Thank you so much.
Is the transfer of this patient in labor a violation of the Emtala law? Before you answer, remember, under the Emtala law, pregnant women in labor are categorically unstable and should never be transferred unless they need a higher level of care. So, what do you think? Is this transfer a potential Emtala violation? No, this transfer is legal. If the patient, though unstable, is competent and requests a transfer, then such transfer is legal even if the appropriate level of care is available at her current location. In this case, the only area of potential risk is that the obstetrician did not come in to see the patient and assess her personally. But If it is the written hospital policy that the labor and delivery nurses may perform the initial assessment, then this case would likely pass scrutiny. There are 3 general conditions for legal transfer: when the patient becomes stable, if the patient requests it, and when a higher level of care is needed. To be legal under the Emtala law, your transfer of a patient to another facility must meet at least one of these criteria. Our final example takes place not in the hospital itself, but in an off-site radiology facility.
Hi, can I help you?
Yes. I hurt my wrist a few days ago playing basketball, and I thought it would feel better by now, but it doesn't. It hurts quite a bit. Do you think I can have an x-ray taken here?
Who's your physician?
What do you mean?
I mean, who's the physician who sent you here for x-rays?
Oh, I didn't see a doctor. I just figured since it hurt, I would come down and have an x-ray to see if I broke anything.
Well, sir, we can only take x-rays if you have orders from a physician requesting them.
So you mean I have to see a doctor first in order to have my wrist x-rayed? Where can I see a doctor then?
Well, you could go to the hospital or to any doctor of your choosing. It's really up to you.
Has this clerk violated Emtala law in her handling of this patient? Keep in mind that this department is not designated as an off-campus emergency department. This is not an Emtala violation. CMS clarified the applicability of Emtala to off-campus hospital departments in its 2003 final rule. Emtala now only applies to off-campus hospital departments that are used as emergency departments and are equipped and staffed to be used a significant portion of the time for the initial evaluation and treatment of outpatients with emergency medical conditions. Even though off-campus provider-based departments that do not routinely treat emergency medical conditions are not subject to Emtala, some individuals may occasionally come to them to seek emergency care. When this happens, the clinic can call an emergency medical service if it is incapable of treating the patient and furnish whatever assistance it can